And now let's go to some of the other things that's in here that are catastrophic. So again, he was talking about the Medicaid cuts. They are catastrophic. It will be nearly $1 trillion in reductions over 10 years on the Medicaid cuts. Let me say that again. $1 trillion of reductions over 10 years. That's basically $100 billion a year. Um, and how do they get there? By doing work requirements. 80 hours per month starts in 2026. On the face, it says, "Oh, okay, you're getting free healthcare. You should be able to work, or and you can also do community service." On the face, it sounds good. It sounds like we could, that may sound like a good thing. However, that's the catch 22. A lot of these work requirements, um, if you don't report in time, it makes it much harder to report. They put it on the states, and the states aren't getting more manpower to be able to do this. They're just having to do it. So a lot of people will fall through the cracks and not get reported, or not know that they need to report, and they will lose their coverage and not know until it's too late. So that's one of the reasons, and one of the ways how they get these savings is through that. There will be stricter eligibility requirements as well to get Medicaid, which obviously, if you're not eligible, you're not going to get it. So that's going to make it much harder as well. There will be introduction of new out-of-pocket costs, which we're going to talk more into here in a second, because that can be catastrophic and make people not want to use this service, even if they do have it, because they may not be able to afford the out-of-pocket costs. So that's another one. So projectedly, through these cuts, there'll be 8.6 million people are projected to lose their health coverage, and that's really a low ball figure. It's really going to be a lot more than that, because this isn't taking into account the people that are on Medicare, the senior citizens that we have that are on Medicare that's going to lose their coverage as well. Um, because this only accounts for people that will lose coverage entirely, not people that will still have some type of coverage in and of itself. So again, the impact on the low families is the increased paperwork creates a greater risk of losing the coverage. Compliance with work rules will make it difficult for many. Some people, now you may have to choose, if you're at home, a stay-at-home mother with your children. Now, if you have to get a job to be able to afford the Medicaid, how are you going to pay for health care? How are you going to pay for childcare? You may not be able to. So you have the choice to make. Do I pay for childcare, or do I lose my health care? I mean, it's you see how people can actually lose this coverage, and this doesn't just. And to be honest, this doesn't Medicaid doesn't affect me, actually, but it affects my family. It affects some friends and family. Sometimes we have to look at life that is bigger than just us. It's not just about what can affect and what's good. They're good for my family. It's how does it affect everybody. We have a financial strain, like I said, for co-pays. We have the safety nets of hospitals. Because there's less funding in the hospitals, there'll be less funding towards the hospitals. There'll be less funding for us to be able to that these hospitals are actually closed. I'm sorry, I'm trying to figure out what's going on with my camera at the same time and talk to you guys. But some of these hospitals will wind up closing because more people are uninsured going to visit the hospital and visiting doctors. So that means that eventually, because less people are insured, that means that our premiums go up. It's no difference than cars. Being from Philly, I remember back in the day, there was a lot of cars that didn't have insurance, and Philly insurance was extremely high. Why? Because there were so many people who didn't have insurance that was having accidents, and insurance companies having to pay for people who didn't have insurance. So what did they do? They had to raise their insurance. So that's the same thing that will happen in healthcare. The people, and more people don't have it and still using the system, and health companies are having to pay more. Health companies having to pay more, which means the hospital is going to have to charge more, which means that eventually we're going to have to pay more while we have our insurance for our premiums and for our co-pays. And like I said, there'll be a decline in access to care, and eventually, when you don't have care, what happens? People will die. People will die because of this bill. And that's just a fact. That is a proven fact. That when you have less health coverage, it will affect people, and people will die from this. All right. Like I said, the new out-of-pocket expenses, it'll be $35 co-pays, unless it's an emergency. There will be some premium and other fees associated with it if you're not above the FPL. And you're probably asking, what is the FPL? The federal poverty level. That's $15,000. Think about that. The federal poverty level is $15,000. So if you make $16,000, that's not even what, 12 bucks an hour, not even. You will have to pay copays when before it was free. Like I said, this tax bill hurts the poor. The poor goes from they would actually have to pay, including stuff like this. They'll lose $700 out of this. Meanwhile, the top 1% will gain over $300,000. It's absolutely ridiculous. Like I said, but some of the exemptions for copays is primary care, pediatrics, and ER visits. Lastly, again, talking about the work requirements again, you got to have 80 hours per week with month or volunteering. If you are going to school, luckily, if you are going to school, you could opt out of that. We got some stuff that's going on with schools in this bill. Other eligibility requirements, more frequent and more strict to see to make sure that you belong on a system, which will cause a delay in paperwork. Um, there's be some cost sharing, again, talking about the co-pays and coverage losses. Again, thank you everybody that's watching. If you would like to join the conversation, please go ahead and hit the link that I put in the Facebook as well as the YouTube. And you welcome to join the conversation.